Welcome back to TV5 News at 9. Joining us this morning is Dr. Hesham Gayar. Thank you so much for being here, Doctor. How are you this morning?
I am doing great, and thank you for having me.
Of course, we are delighted you're here. So today we are talking about proton therapy and breast cancer. Now first, doctor, for those who are not familiar with proton therapy, what is proton therapy?
Proton therapy is subatomic particles. Unlike normal radiation, which is X-rays that goes through the body, protons are subatomic particles that shoots and stays to the target. So it has a Bragg peak. The maximum radiation is delivered to the target and the beam stops, does not go through, which means it's high precision. It doesn't cross the target to normal tissue, reduces the side effects, improves the quality of life and the problems happening from treatment. Because of normal tissue, our organs getting unnecessary radiation with the conventional beam is avoided. It also has more potency, so there's about 10% more cancer killing than the conventional radiation. So you basically have more cancer killing, more protection to normal tissue because it stops at the target. The high precision and the fact that it's a different type of radiation, it's like tiny particle therapy located, directed to the target precision.
Wow, so precise and targeted therapy. Now, doctor, how can proton therapy help with breast cancer?
Breast cancer is a very common cancer. And when we treat breast cancer, unfortunately, we have to include a lot of tissue, and a lot of sensitive, important tissue is present around the breast. Do you mind if I share some images, some slides?
Oh, please, we'd love to see that, yes.
Breast cancer has been shown from regular radiation that small amounts of radiation is going to the heart, which can be harmful to the patient's heart and can lead to heart disease and ischemic heart attacks later in life. Even low doses can do that. And if we look at a patient CAT scan here, when we treat with conventional radiation, the regular radiation, the beam goes through. And in this patient, if we give X-ray photon, the beam going through and through will get the heart in the way. So when we treat, we're accepting the heart or portion of the heart getting treated. Proton therapy treats and the radiation stops before the ribs and the heart is completely spared. So if we compare, like another example here, the patient here on the left has proton therapy, proton therapy treatments. The one on the right has X-ray or photon therapy treatments. You can see how much red and blue radiation is spilled into the heart. And those are the coronary vessels. You cannot avoid some radiation going in there, which can lead to damage later on in life. It can be 10 years, 20 years later, heart attacks happening. But if you use proton therapy, you can spare those arteries, and we pay attention to that, and completely stop the radiation where it belongs, only to the breast, because it comes straight and it stops at the target. That's the main advantage of proton therapy. And this is the difference. This is what you avoid.
That's right.
This is the amount of radiation that you don't need to give, and you accept when you're giving photons. So to simplify it, patients, especially left-breasted women, we accept a lot of radiation to normal tissue around the breast, which could include the heart and parts of the lung that could be avoided with proton therapy.
Thank you, doctor, for helping us visualize how proton therapy actually works. Now, how can people find out if proton therapy is the best treatment for them?
Proton therapy, the best way to find out is if radiation is part of your treatment. So if you have breast cancer and you hear that radiation is going to be part of your treatment, or you need to see a radiation doctor, or we will do surgery, then radiation. And if your breast is conserved, if they're keeping the breast, then you have radiation treatment. Call us and ask, I have this situation, would proton therapy will be better for me? and then we'll be glad to go over it. If it is worth it, we'll help you. And if you live outside, away from Flint area, we have means of making it easier for you, accommodate, and we can see you by telehealth, by distance, discuss the case with you, go over the facts even before you coming. And if it's worth it, we can accommodate and support you, either by help, or there is a hospitality house that patients can stay when they come and visit and get the treatments with nominal fees, or even grants if there's difficulty financial.
Oh, that's great. That's so convenient, doctor. We appreciate that. So how can people reach out to you for more information and to contact you?
Very simple. It's call us at 1-855-MY-PROTON, so 855-MY-PROTON, or visit the website at mclaren.org/proton treatment, mclaren.org/proton treatment. And we'll be glad to, you can send us a message, call us by phone. We'll talk to you. There will be a navigator that speaks about the case, find out the facts, share it with the doctor, and only if it's worth it, you can come over. Or we can meet you by telehealth and discuss the case and compare it to the standard radiation. If you don't learn about the options and investigate what proton therapy could do for you, you may have just what's available locally or what people tell you. And unfortunately, sometimes people don't share all the information because sometimes they don't know it.
That's right. Doctor, is there anything else that you'd like to add about breast cancer or proton therapy for our viewers?
I think breast cancer is a very common disease, and I encourage all women to get the screening done early. And if you feel any lump in the breast, not to stay on it. For breast cancer, especially if there's a concern about lymph nodes, there are lymph nodes inside the ribs that sometimes the doctors give up treating because they're worried about the heart with photons. We can treat those with proton therapy, sparing the heart, because the beam stops at the target, does not go through. So left-sided breast cancer, if you have left-side breast cancer and you're going to get radiation, ask if proton is better for me, and we'll be glad to go over it. The savings of the normal tissue is significant, and the heart is a very valuable organ that we need to protect.
Dr. Gaillard, thank you for breaking this down for us and really helping us to understand this in such easy and simple terms. Thank you. We appreciate you, Doctor.
Thank you very much for having me.
Oh,
always enjoy your program.
Oh, appreciate you. You are welcome anytime, Doctor. For more information, you can just head on over to the hot link section at WNEM.com.